My next guest is Joan Lunden. Yes, the Joan Lunden, the award-winning journalist and host of Good Morning America for nearly 2 decades. Today, she's a best-selling author, motivational speaker, and successful entrepreneur, keeping Americans up to date on how to care for their homes, their families, and themselves. It's a real pleasure, Joan. Welcome to the show.
Thank you. Great to be with you.
You are a true member, from talking to you, of the sandwich generation. You're raising 2 sets of young children. You have 25 and 30-year-old children, and then you're also helping your 94-year-old mom. How do you manage all that?
I think if you look in the dictionary under baby boomer sandwich generation, my name might pop up.
I think it may.
Well, you know, my older girls, I have older girls who a lot of people who watch me on Good Morning America will remember. I had them, while I was on the air. Not completely on the air, but darn close, darn close.
Uh-huh.
And then they're 25, 30, and 32. And then I remarried, and I've got these twins. I have a boy-girl set that are 10 and a boy-girl set that are 8.
Mm.
And meanwhile, my mom is 94 and still doing, somewhat well. And I'm very typical. I'm like, the average caregiver in America is a 49-year-old woman who has a job outside the home, but who is still either raising children or trying to finance sending them off to college, and then also responsible for an older, a parent, either hers or her husband's, because in most cases it still falls upon the shoulders of the wife. And, you just listen to me say that. I mean, that's enough to take anyone down.
Mm-hmm.
And it does quite often. And so, having gone down this caregiver road, I really kind of made a vow to myself that I was going to dedicate a good part of my career in helping others. I mean, because, there are, 50 million or so of us in this country. They're caregivers responsible for taking care of someone else. And it's an interesting and challenging road to go down because there's so much to know about it, like Medicare, which we'll talk about in a little bit.
Mm-hmm.
But there's also the emotional side of it. It's strange when you become the parent to your parent.
Right.
It's not like going through other life changes where you learn to go out on your own, you learn to get married and live with someone, you have a baby, and all of a sudden someone else is the most important in life. Like, all those changes are kind of natural. But when all of a sudden you have to learn to be the parent to the person that for all of your life you've been used to being the child, it's an uncomfortable changeover for a lot of people.
A lot of people still experience this idea of acting like the child with their parent, even though they're in their 40s and 50s and 60s.
Yeah.
And it's hard to kind of get the right perspective to turn the tables around to say, no, now I really do have to grow up finally and make good, sound decisions and not treat this person, wondering whether they approve of the way I'm acting type of thing. So, I know you've been doing this for a while, and I know you just mentioned to me off air that, you've made some mistakes starting out. What were some of the mistakes you made, and what few ideas can you pass along to our
Biggest
listeners?
mistake,
Mm-hmm.
I didn't have a plan. You can stick your head in the sand because you don't want to think about it, and you don't want to force your parent to talk about the idea of getting older, so you don't have the conversation. And what happens is that then you get that call, and you're in crisis mode. That is not the time you want to be dealing with this. If there's one thing everybody listening hears today, you're in your 40s, pretty much you should be having this discussion amongst your adult siblings. Probably best that everybody get together in that group first without the parents to have an honest conversation about how do we think we're going to handle this as mom and or dad can't live in their house anymore, and how are we going to handle the finances, who in the group wants to take care of that. Like, go through that, and then you have to have that difficult conversation with your parents because you have to understand in your gut, in your core, what their situation is. Are they financially able to take care of themselves for possibly 30 years after they retire? Because that's really what you're looking at today. People are living longer and longer. Nobody expects, a lot of the adults like you and me who are taking care of parents, it wasn't so much that our parents were incredibly irresponsible and didn't put enough money away. They didn't expect to live beyond 70.
Mm-hmm.
But, here they are living to 95.
The financial responsibility then falls on the children.
It absolutely does. And I'll tell you, right now we are living in a time where all across this country, there are Americans who are dipping into their own retirement funds, which are already in good part reduced because of everybody's pension plans and 401ks, and maybe they're part of a pension of because they work for the state or they were a teacher or whatever it is. they're all underfunded.
Mm-hmm.
They all came down in value. And now here you are dipping into them because you're having to shell out the money to take care of your parents who simply didn't put enough money away to live for the amount of years that these days you can be expected to live.
Your mom is 94, 95 now?
94. And,
94?
And I did ask her the question, did you buy long-term health care?
Mm-hmm.
She said, oh, yeah, I did, sweetie. Well, it was a 3-year policy.
Mm-hmm.
And she didn't think she'd need it beyond 3 years, I would venture to say. But believe me, that policy was done like 4 years ago.
Yeah.
And so it's completely out of my pocket. And it's a very expensive journey. And a lot of this last year, we saw a lot of people move out of assisted living and into homes with their adult kids simply out of necessity, out of financial necessity. And that just brings on a whole other set of emotional issues and, how you keep the emotional strength of your own family, you and your husband and your children, and that you don't get marital problems or, that the house can still function. So tens of millions of Americans are dealing with this right now.
I'm talking with Joan Lunden, the award-winning journalist, and I'm sure everyone knows her as the host of Good Morning America for nearly 20 years. And we're talking about the elder care, so to speak. Joan, let's focus on Medicare. There was a recent survey commissioned by Walgreens examined the behaviors and understanding of seniors currently enrolled in Medicare Part D, which is the drug part of the Medicare program. What did they find?
What they found is that while most of the 31.5 million Americans who are enrolled in Medicare Part D thought that they knew their programs quite well, when you really started asking specifics, half of them did not realize that copays were different prices at different pharmacies. They thought that you couldn't change from one pharmacy to another except only during the enrollment period. Enrollment period is that time from October 15th to December 7th when you can enroll in Medicare, either just the general Part A or the prescription Part D, or change plans if you want. But you can change your pharmacy any day of the week. The troubling part of this survey was that it found that 1 in 5 seniors said that they are making decisions on a weekly basis of whether to skip doses of their medication in order to try to make prescriptions last longer, or to simply not get prescriptions refilled. And 1 in 4 said that when a doctor writes a prescription, they never get it filled. Now, the problem with all of this is that we know where they're going to end up. A condition going unchecked, they'll end up in the hospital, and in the end, that's going to be a far more expensive bill. And non-adherence to medication therapy, it's estimated that that costs our healthcare system about $300 billion a year. So we really have to address this problem. We really have to help seniors understand how to get the lowest copays and make their healthcare dollars stretch as long as they can. And there has been a little bit of a change in the Medicare Part D, the way it works, over the course of the last couple of years. And this is that change. Now, different pharmaceutical chains have aligned themselves with different policies. So maybe you are in United Healthcare. If you're in United Healthcare, you need to find out what is the preferred pharmacy network in my policy. Now, United Healthcare, it happens to be Walgreens. They have joined United Healthcare, Humana, Smart D, and Coventry. And you might go in, and maybe yours is Blue Cross Blue Shield, so you need to go and find out what pharmacy is the preferred pharmacy. When you find this out, if you're shopping outside of the preferred network, you're paying too much.
Yeah, I think you're making a good point, because I think we all assume that you get a prescription and you go to your pharmacy and they're going to fill it, and that the prices are, probably, or the copays are probably pretty equal across the board. I think what I'm hearing you say,
they're not.
They're not, because your particular insurance company is going to have a relationship with a Walgreens or CVS or whatever drugstore.
They're all pretty much aligning themselves with a pharmacy.
Yeah, that's good information to know. I didn't actually know that.
In fact, there are 8,000 baby boomers retiring. I shouldn't say retiring, turning 65 every single day. 8,000. And that is going to continue for the next 19 years. So we're talking about a tremendous amount of people who might be listening who are just coming up on that time that they're going to have to, this October 15th, enroll in Medicare Part A, and then they're going to have to go to the Part D if they want prescription coverage, and they're going to have to choose a plan. And quite honestly, if you live right next door to a certain pharmacy and you've always shopped there and you know that's where you're going to go, make sure that when you're choosing one of these plans, ask, what's the preferred pharmacy?
Mm-hmm.
And make sure you choose a plan that's going to suit you, because you can save, literally, you can save up to like 75% on the cost of prescription drugs if you stay within your pharmacy.
Did they find, or did they ask people if they understood what the donut hole was in the Medicare Part D program?
I don't think this survey did, but I certainly know because it's hit me. And, in an effort to try to bring down the overall cost of the pharmaceuticals, because I'm in charge of my mother's prescription drugs. And, I hit that time every year where all of a sudden you've hit that cap and they won't pay anymore.
That's right.
So then what happens is you find that the last 3, 4, 5 months of the year, you're paying full bore. And that is, it's just astronomical. One of the other ways you can cut your prescription costs is to change to a generic. And let me tell you, there are a lot of insurance companies now who are only allowing you to buy generic prescriptions.
Right.
So these are big questions that you have to ask when you're looking at a plan. And the problem there is that, you can save a tremendous amount of money by switching to generic. The only problem is that you may go to your physician or your pharmacist, because your pharmacist is your medication expert. They're really the ones who understand the active and the inactive ingredients. And they may tell you, you can switch to this. You're just not going to get the same outcome.
Who will tell you that? The doctor?
The pharmacist can definitely tell you that, because they know exactly how the two different drugs line up against each other.
So are you saying instead of asking your doctor what the appropriate generic would be, perhaps you should ask your pharmacist?
Well, I think people should always consult with a doctor, but, a lot of people will say, I can't go back in, I can't get it paid for, and I just don't want to go back in just to ask about a pharmaceutical. Your pharmacist is a medication expert, and they're the ones that are really up to date and that get asked this question all the time. And it doesn't cost any money. Like somebody listening to us right now, you can go, if you're online, you can go to walgreens.com/Medicare, and you can find out some of this. But frankly, a lot of seniors aren't on the internet. So you can walk into a pharmacy. I know Walgreens just because I do a lot of health programs with them. You can walk in and say, I want a plan review. Show them your card. They'll see what plan you're on. They'll tell you if there's a preferred pharmacy in it. And if you've taken a list of all the pharmaceuticals that you're on all the prescriptions, or heck, if you want, just take all the bottles of pills, put them in your bag, take them in. They will do a cost comparison for you on copays, and they'll tell you if you're paying the lowest that you can pay.
My guest is Joan Lunden, former host of the Good Morning America that we all know and love. We're talking about Medicare Part D, and we're trying to talk about ways to save money. So, Joan, you mentioned match your insurance company with a particular pharmacy that you're getting your meds at. You can probably save money there. Choose generic and, of course, get your doctor's opinion, but also talk to the pharmacist, maybe get an analysis of the drugs that you're taking and get some recommendations as to what would be appropriate substitutes. Are there any other ideas, maybe a final idea that you can leave with us?
Yeah, just like you would shop around, probably if you were going to buy a brand new TV, you'd shop around. You'd find out who had the best price on it. But we don't tend to do that with prescriptions. We've always been taught to be compliant, obedient patients.
Yes, not anymore.
You can't do that anymore.
That's right.
You need to be an active participant. You need to be the CEO of your health. You need to go into these doctors with a list of questions. You need to take notes. Take someone with you if you want, so that they take notes. Ask questions. Ask, what are the benefits of taking this certain test or taking this certain drug? Make sure that the cost is worth the benefit that you're going to get. And the same when you walk into a drugstore. Sometimes if you tell them, I can get a better price right down the street, they'll match it. And don't just think because you got the lowest price that maybe you found somebody that'll give it to you for a $4 copay. If you ask around, you can sometimes find it for a $2 copay. The only caveat that I'll say, I don't believe that it's in your best interest, health-wise, if you're taking 10 drugs, which is not uncommon, by the way, for a senior, to start shopping around and getting all 10 drugs at different drugstores because you got the best price. There is an inherent danger in that because none of those pharmacists will know about the other medications you're taking. So better to stay within your network, find out what network's on your plan, and then go and see the cost comparison. You might end up buying one somewhere else, but make sure that one pharmacy has the entire list of every prescription you're on so that they can tell you if one doesn't interact well with another.
Yeah, keep it simple, because if you're taking 10 medications, it's prone to error. You want to be careful. Right. And I think what I also heard you say, which is vitally important, is be your own healthcare advocate. And if you can't, get somebody in there to help you. You know, sometimes you go to the doctor, and if they say something serious, people check out, you know.
Oh, yeah.
Your mind goes kaflooey. You need somebody in there, or a tape recorder or something that you can refer to later that actually heard what was really said.
Half the people walk out of there, and 2 weeks later they're in another office, they're asked to fill something out, and they don't remember anything the doctor said.
Right.
You want to walk out with a list of your blood pressure, your cholesterol, and you need to understand what those numbers mean. You know, if they're high and they should be lower, you need to understand what you can do in order to bring them into range.
Well, I thank you very much for joining us. My guest, Joan Lunden, former host of Good Morning America for nearly 2 decades. And Joan, this is the first time we've ever spoken. Pleasure to meet you, and I'm so happy that you were able to appear on our show. Thanks so much.
Absolutely. I look forward to doing it again.
Thank you.
All righty. Bye-bye.